How many of you have been on excursion before? This is excellent. This is beautiful. Can you clap your hands for yourself? A setup where a group of professionals, doctors, nurses, lab scientists, even the artists, those that can help and tidy up the environment so that when an ill patient is there, we enjoy free, good atmosphere. Is that taken? Now you ask yourself, why must there be a hospital? What is the gain of having a hospital? What is the functions of having a hospital? Anybody who can hear? Yes, good. An attempt. Who said yes? Excellent. Yes, can I hear you? Taking care of a patient. Proper taking care of a patient. This is excellent. Workers are there to take care of that patient, to alleviate suffering, that is to take away suffering from a patient, to relieve pain. In a hospital, the aim is to relieve pain, to prevent complications. That is why the hospital is business, to prevent complications. To help the dying. There are some people that their case has gone beyond control. Do we close eyes and watch that person dying? No. You must do little things to make that patient comfortable. You can see our nurses in their immaculate white. Are you not appreciating how beautiful they are looking? Look at them very good. Are you not? Yeah. They are beautiful. Who wants to be like as beautiful as they are? Can I see your hands up? This is excellent. Beautiful. Wow. You are going to be that in Jesus' name. So under nursing services department, we have two units. The bedside nurses and the tutorial section. The bedside nurses. Bedside nurses. Bedside. What do I mean by bedside? Those nurses that the patient now is on admission. They will come and take care of that patient. In the morning, they will greet the patient, vet the patient, encourage the patient feeding, and give the hospital feed the patient. They will feed the patient and give that patient his or her drugs. The side nurses, the nurses that take care of the patient in the ward. Another unit of the nursing department is the tutorial. Like some of the hospitals, they have units that train nurses. So there is a unit in nursing services department that trains the nurses. Are you there? Now that is nursing services. You have the medical services department. Medical services department. You can see our doctor here. The doctors are in charge.
How many units do
How many? Paramedical has a lot of units. You have works, those that run for the welfare of the hospital. You have even chaplain, assuming patient is bad. Like the Catholics, they quickly invite a reverend father to come and pray for that person. Anglican will send the pastor to come and pray for that person. We have drivers and vehicles, assuming the patient needs to go out for any further management to now transport the patient. You have the laundry section unit inside paramedical service division. You have the laundry, the people that take care of the patient cleaning, the bedsheets, macintoshes, and the rest of them. These, they don't give injection, they don't carry spin and needle. Is that thinking?
Now we put our hands together for veteran. Partners with health
Good morning, students. Good morning. Those at the back, can you hear me? Yes. My own name. Ready? Don't say ready. No. Hello. No, please, I don't want side talk. Understand? Because this topic is a very important topic for both male and female. So, have you heard of the topic sex education?
Yes.
To be interactive since you've heard of it. So we just have to highlight one or two things we need to know while growing up. So we start by defining what sex education is all about. It's actually a broad topic, but we'll highlight the most important ones. All of them are important, but we'll highlight the important ones. So sex education is a provision of knowledge about your body development, healthy communication, healthy skills. Sex education has to do with, I know, because we've heard sex, you think about it being intimate with a boy or a female. It has to do with learning how your body changes. As a male, when you start growing, you start having hair in your private areas, start having broad shoulders, and you start having big boobs. Then for girls, you start menstruating, right? Now, one of our notes will take you on how to maintain your body as a lady. So what are the importance of this sex education? Why do we teach sex education? It's important so that you know how to communicate well. You have a healthy communication with people. You create boundaries. As a lady and as a male or female, you should have boundaries. You should set boundaries. Sex education helps you to have a high self-esteem. What do I mean by having a high self-esteem? You have confidence. You can speak up. You can be bold to say no to this. We have some topics under sex education. We have abstinence. We have personal hygiene. We have reproduction. That's anatomy, study of human body. But we'll not be going into details. But I just highlighted one topic I'll be teaching you on. Saying no to sexual assault. You are not too small to hear that. Now or later, you still come across it. It's either someone teaches you, it's either your teacher teaches you, or your parents, or an adult. But it's better you get known to this. You should create boundaries as a man or a female. You being a lady, if a man is touching your breast, what will you tell the man? How will you react? Will you just say, no, uncle, stop, uncle, stop? You have to, that means creating a boundary. Now, how do you go about it? You have a neighbor who always like carrying you. As a lady, you don't need a man to carry you. Tell uncle, please, I can sit on my own. My legs are not paining me. No uncle should call you inside. Come inside, please. Come and buy something. Come. No. That's the time for you to be bold and tell that if you repeat this thing again, it's either I'll tell my auntie or I'll tell my parents. Most of us, those uncles might protect that they are pastors. Now, your parents might not believe what that uncle is doing to you. Then you can even talk to your teachers. They can intervene. You have a favorite auntie, right? Yeah. You have a favorite uncle, right? Yeah. You do gist. Now, you call me uncle. The way this uncle is approaching me, the way this auntie is approaching me, I don't like it. Since your friends don't want to believe you, you should speak up. Whereby you start hiding those things, it causes emotional trauma. If you have been assaulted at a young age, it causes emotional trauma. That at age, you might even, as a girl, if you have been assaulted, you end up hating guys. Some have a reason, I'll not get married, I hate guys, and you find yourself doing sorts of unnecessary things. This also applies to male parts. You should create boundary. No auntie should touch you. No auntie should call you inside, come and get this or get that. Now, if in a case that you have been assaulted, my dear, talk to somebody. Talk to somebody so that things can be done about it. You hear what I'm saying? You should know that this is my body and it belongs to me. Even you being a female, another female should not touch you. It's called lesbianism. They should not touch you in a video. Anybody that touches you in a way that you are not comfortable, you know that you don't like it and it's an abuse. Do you understand what I'm saying? I'm not saying it will only be a male that will touch a female. No. We also have lesbians. You understand? So, a female, your auntie, I don't want to know if it's your auntie or your cousin, they should not touch you in a funny way that you don't accept. You're a woman coming up. So, what if you've been assaulted and you keep quiet and that uncle ends up having a carnal knowledge of you, and at the end of the day you get pregnant? Would you like it? No. Now let's play a scenario. 9 months. 9 months. You don't start school. Let's say a male and a female. Now the uncle has gotten you pregnant. He can actually deny you. You know that. He can deny you since he's a neighbor in that compound. He can deny you and run away. Now you'll be faced with the consequences. He can go ahead, get married and have his life in check. But you being a female, you have a very bad risk. My other colleague will also talk about effects of unwanted pregnancy. But I just want to pick a hint on that. Now after 9 months, you are pregnant. Being 16, being 15, you're carrying pregnancy. You might even die. Now after 9 months, you've given birth. It doesn't guarantee that you start school immediately. You still have to breastfeed your baby. If breast milk is even coming out from that your small breast, you still have to breastfeed the baby. Now, just imagine at the end of the day, you'll be subjected to selling oranges, selling fufu in the market. Now you see your classmates pulling over with Range Rover. What will be the first thing you do? You will hide your face, right? So that's what we're saying. Say no to sexual assault. What did I say?
Say no to sexual assault.
So no man, no one has the right. Let us even make it clear. Even your dad does not have a right to touch you in a funny way.
Yes, sir.
Do you hear me?
Yes.
You being a lady, your dad does not have a right. Even if he's your dad, he doesn't have a right to touch you in a funny way. As a man, create that boundary. Stop this. And when you mean stop, but if they persuade, that's when you have to report. So today what I'm saying is that as a lady, as an upcoming man, create boundaries for yourself. This is mine. That's why it's called private. That's why it's called what?
Private.
Something that is private means it's personal. It belongs to you. It's not meant to be shown to the world. It's personal. So today I'm telling you to say no to sexual assault. If you know of a friend that is being assaulted, you can help the friend to speak up. If you know this, you understand? Because there are some, they might be very scared. Maybe that uncle has threatened, I'll kill you, I'll kill your parents, I'll kill your sister. No, those things doesn't work anymore. There's no way I will report to you and I'll even tell them that you said you will kill them. So if anything happens, they will point to you. So today I'm saying you should say no to sexual assault. Say no to sexual assault.
Let's put some hands for her. Thank you. What do you want to say to her? Thank you.
Hello students.
Hello.
Morning. I am Nurse Peace. You're welcome to our facility. I want to talk to you about personal hygiene. What did I say?
Personal hygiene.
Have you heard of personal hygiene?
Yes.
Can someone tell me what personal hygiene is? Your own body.
Taking care of your body.
Did you hear me?
Yes.
Yeah, clap for him. Personal hygiene. Can you hear me from the back?
Yes.
Personal hygiene simply means taking care of yourself. Proper taking care of your whole self. You're taking care of your what? Your whole self. To avoid germs, to avoid diseases, to avoid infection, to be confident enough in the midst of your peers, to look good in the social gathering. What are the importance of taking care of your body?
To prevent smell.
To prevent what? Smell. Not only smell, it prevents diseases. Because when you are dirty, you're giving room for bacteria to enter your body. And when bacteria enter your body, it will cause sicknesses, it will cause diseases for you. Can you hear me?
Yes.
And then when you pass, you will smell. You have an odor. Because when those bacteria are there, they will make you to smell. What are the areas that you're supposed to take care of very well in your body? Your nails, don't worry. Your nails. What did I say?
Your nails.
Your feet. Cut them. You make sure you look good. And it helps you when you're out with your fellow students. It gives you the confidence to talk. It gives you the confidence to be in the midst of people. Because you know that you're fine, you're okay. Can you hear me? Yes. So that's all about personal hygiene. Personal hygiene makes you, when you look neat, it makes you look smart. When you come out, you look good. You talk very well. You look smart. Your clothes are neat. Your legs are neat. Your hands are neat. You cut your hair. That's what personal hygiene is what it's talking about. It helps you to mingle among your peers. Hello. Yeah. You will be confident. You will not complain of. You will not hear of this. My stomach is aching me. My this, my that. Those are germs. Those are bacteria. Even what you eat, when you are eating, make sure you eat healthy food. Okay. When you eat good, when you eat healthy, you look good. You feel good. You look healthy. That's what personal hygiene is all about. And for the girls, there's what we call adolescent ages. When you get to this age, you start developing, you see some development. Okay? Your mom, your parents may teach you at home, even your teachers. When you begin to see all these changes, they are signs of what? Development. And then what do? You cut them, you shave. Because when it gets heat, you smell. Make sure you look good. And then during, for those of you who are up to, who have started menstruating, you make sure you bathe also, because when you don't bathe very well, you also what? You smell during this period. That's what personal hygiene is all about. It's a simple topic. You've been hearing it from aunties, you've been hearing it from even your parents at home. That's what personal hygiene is what it's all about. So, in a nutshell, who understand what I just said about personal hygiene? Clap for him. Personal hygiene is what? The proper taking care of your whole self. The taking care of your what? Your whole self. To avoid germs, to avoid diseases, to avoid infection, to be confident enough in the midst of your peers, to look good in the social gathering. Thank you very much.
So without wasting much of the time, I'm here to take you on the effects of teenage pregnancy. What did I say?
Teenage pregnancy.
The effects of teenage pregnancy.
The effect of teenage pregnancy.
Does anybody have idea of what teenage pregnancy is all about?
Getting pregnant.
Okay, that's a good word. That's a very good word. People have just said it all. It refers to when a female child getting pregnant under the age of 20 or 18 as they said, or 20 applied. So as a girl, which can have a way of harming you, putting your health at risk, getting pregnant at an early stage is not good. Are you getting me? And there are things there are causes of this teenage pregnancy, which is poverty. In a situation, maybe for example, whereby your parents cannot afford your needs, you'll be forced to go out to meet all these young boys that will give you 200 naira to buy bones. And from there, you'll be forced to do what you don't want to do. And at the end of it, you find yourself getting pregnant at an early stage. Another one is this cultural factor. Another cause is lack of education. When you don't have knowledge of reproductive or sex education, don't have the knowledge of it, you don't know what to do. That is how you get yourself into getting pregnant at an early stage. You get? If somebody is trying to harass you at your age like this, you talk to your parents, talk to your teacher to avoid being pregnant at an early stage. Are you getting me? Try to be open to your parents. Rapport with your parents, rapport with your teachers that can help you out. If you cannot talk to your parents, I believe there are teachers you can talk to that can help you talk to your parents. All those neighbors that might want to harass you, to avoid being isolated from your friends. Because one risk factor of this teenage pregnancy is isolation. You'll be so ashamed of yourself that you cannot even associate with your friends. And even your friends cannot even associate with you as well. Are you getting me? Yes. It can also limit your career opportunities. Hereby, you want to become a doctor, a nurse in the future, but due to your stage and your parents cannot even support you, your career has been, your career has finished. Another one is this. You have school dropouts. You drop out from school. Once you notice you are pregnant at this your age, you can no longer continue with your education. You will stop. And you can't afford to see yourself being a school dropout at an early stage. Your friends are going to school, learning. They will come out of secondary school into university. And you are carrying a baby. It can also put you in emotional stress, whereby depression will settle, anxiety will settle. Stress of taking care of a new child at a young age can be so stressful. So to avoid putting yourself at this kind of risk, what you have to do is lock up. You respect yourself. And one of the ways you can prevent this teenage pregnancy is what? Having adequate knowledge of of sex education. Having this knowledge can also help you to prevent this. And again, moving around with friends that will influence you in bad way can also lead you to have this teenage pregnancy. Peer pressure. Where my friends are doing, let me go and do. You go and do and get pregnant. Are you getting me? Yeah. So for you to, avoid you getting pregnant at an early stage, for you to avoid it, you have to respect yourself, face your studies, mind your business, avoid bad friends, bad companies. Are you getting me? So another thing again is, like I said, if there's anybody harassing you, harassment can lead to this teenage pregnancy. If there's anybody harassing you, you talk to somebody. You even if it's your parents, your teachers, like I said earlier, you talk to them. You get to avoid you getting pregnant and your friends not be laughing at you. Amaka is not pregnant. when that's ended. If you don't want to be to end up in a shameful way, in a shameful manner, you have to do what? Respect yourself. Thank you, students.
Thank you, ma'am.
So my own, I want to talk about drug abuse. Just fortunate that the seniors are not here. They are the major people, they are main target people that normally abuse drugs and substance abuse. So substance abuse, drug abuse is also known as substance abuse. It's a pattern of using a substance or drugs that can endanger people's health, endanger your life. So when you use things that are not, maybe use it in excessive mode, and it will not endanger your health, that substance has been abused, has been used it indiscriminately. So there are types of things that you can abuse. Alcohol. Maybe you went for a party or a wedding, there should be alcohol everywhere. You decide to drink and drink to people. So drinking excessively, all the drinks, all the drugs you take go straight to the liver. It's the liver that metabolizes every substance taken in. So when you give excess alcohol or excess substances that are very harmful to the liver, it will not cause inflammation or endangers that organ. There are so many organs that will be affected, especially I mentioned liver. It can lead to liver cirrhosis. You see that person having a pot side of abdomen, the stomach will just look as if it's pregnant. So that's the major signs of it. So what are we saying in fact? That is not good. Prevention is better than cure. So it's better we prevent all those things that are taken, all those substances. The only thing it makes them to be high. It has a kind of etheric nature in it. It makes that person, for instance, if it's analgesic, all those opioid analgesics, maybe tramadol. Have you heard of tramadol before?
Yes.
You have heard of tramadol?
Yes.
You have heard of cocaine? Yes. You have heard of cocaine? Yes. Those things are substance abuse that when you take it, it will make the person, if it's like painkiller, those opioids, strong opioids, it will relieve the pain immediately and make the person to have more kind of euphoric nature, as it make you to be light and free. From that moment, some of them can even cause sedative nature, as to make the person to sleep and wake up, no sleeping pills. So those things are it has negative effect on us. It has negative effect on our health. So many people have been abusing drugs and it has been causing damages to their health, which they don't know. Maybe soon, even if others are doing it, you people are world changers. Change the world for good. Do you understand? Yeah. That is why even your school is a mission school. So in school, you set example for others. If you see others doing it, you say, no. The auntie said, this nurse said, Nurse Lillian, that's my name, sorry. I will not mention my name. My name is Nurse Lillian. So Nurse Lillian said, no, it is not good. So it's not only alcohol. You people know other things they used to take now. Can you mention? Many people have had mental disorder because of those substances that they are using. And when they started, they are hiding it. The people, everybody will know. Why? Because they are not normal again. There is some behavioral changes that it carries. So many people have dropped out of school because of it. I have a brother like that. Since you have been hiding, nobody knew until the head knock. He dropped out of university. Do you understand? This part is under control. Do you understand? So he's regretting it. So it's better not to start it because of when you start it, to stop it is a problem. You know, many people go ahead and steal because you buy it then. You buy it, it's expensive. You buy it. When you buy it, you'll be looking for money, you start stealing. So it carries so many abnormal behaviors. When you don't take it, psychologically you're not okay. It carries mental disease. So is it not better we stop? Is it not better we shun such acts?
Yes.
Right? Because most of us want to be doctor. Most of us want to be nurses, professional, want to be great now. We are dreaming big, right?
Yes.
Are we not dreaming big?
Yes.
So, but if the mental people, those mad people now, where are their visions and dreams? Nowhere. Which they have prevented on earth. So what are we trying to say now? Now you have heard, you are now more enlightened. Can you go to the village, go to your houses and tell brother, my auntie said this one is not good. Then even some mothers, I'm telling you in fact, some mothers will go ahead and be giving their small baby cough syrup. The baby doesn't have cough syrup. Doesn't have cough. You start giving cough syrup. So that the baby, those things have it depresses the central nervous system. It affects that baby later. So all those things are not good at all. That substance abuse, they are abusing it. It's for cough. When the person have cough, immediately the cough stop, you stop. It's just a expectorant. But people go ahead giving it in just to M1M, but they don't know the effect. So it has negative effects. Are you forgetting me now? Yes. No matter who is doing it, people should not, don't get yourself involved. Because when you get yourself involved, to come out of it is a problem. It's a problem. So it has so many consequences. And when you see somebody, report that person. Don't say, he's my friend, I don't want to. Report. So that if the person is being reported and we have to give maybe this detoxify the person, come to hospital and we know how to stop that person from taking that. Because as you keep on taking it, keep on endangering the person's health. Are we okay?
Yes.
Any question? This is the end of our health topics. Any questions so far? Are you okay?
Yes.
Are you satisfied?
Yes.
I want you to go and enjoy school.
Major surgery, intermediate surgery, and minor surgery. So, what do I mean by minor surgery? Major surgery, right, major, intermediate, and minor surgery. So, what do I mean by minor surgery? Minor surgery, are you listening?
Yes.
Are you paying attention?
Yes.
Hearing voices at the back. So, minor surgery. So just like there is something we call, like maybe someone cut you, like knife, someone use knife and cut you, you understand? Or you have an accident, you have a tear, those are minor surgery. It's not required to call anesthetics and everybody to come and attend to you. We just, usually those ones, they don't do those ones here, they do them in accident and emergency, you understand? But there are some surgeries, other surgeries that we call minor surgery because we don't go too deep, we don't call a team, you understand, to come and do surgery for you, it's just a minor procedure. There's something we call lipoma, right? Lipoma down. Lipoma, lipoma. It's a small tumor, it's a fat, above fat. It's beautiful. You see some people, there's a fat, if you touch it, it will move, if you touch it, it will move. We call that lipoma. It's a minor tumor. We don't do big surgery for those ones. But there are some surgeries you do, you open the person up. You've had a fibroid before, you've had a cesarean section before, Those ones appendectomy. Appendix, you've had appendix now. Cesarean section is that surgery you do to give birth to the baby. In case that you cannot give the baby through vagina, it means that you now have to open the woman up and bring out the baby. If you want to be a doctor, you must be ready to see God. So you move, that is the surgery. Those ones are called intermediate. No, not 95, I'm talking about surgery. That's major intermediate. major and intermediate, depending on the so like in the of that area and the appendix, you call them intermediate. You understand? They are studied, they have to enter the lesson, but we don't usually judge the level of the subject when we go anesthesia. Have you heard of anesthesia before? Nobody has heard of anesthesia before. So anesthesia means anything that takes away pain and makes you sleep. But it does not mean that you must sleep. There are some anesthesia we give that do not make you sleep, but you will not feel any more pain. Like the one we want to do cesarean section, we give anesthesia at the spine. We take the woman to bend down and we give it from here downwards, you will not feel anything. You understand? The person will be awake, but the person will not feel anything. Anesthesia is the person to make you sleep. So sometimes we don't even use big anesthesia like that type now. What we do is the place we are going to enter, we put anesthesia on that surface. We call it local anesthesia. It's just like now someone is caught open. Before you enter, before you start suturing the person, you have to give them something to enter. And that local anesthesia is what we give around that area, so that the needle that we are choking the person does not feel. Do you understand?
Yes.
So, if you are supposed not a sterile chapter. You have to know that a theater is a sterile place. What are you saying?
Theater is a sterile place.
Again?
The theater is a sterile place.
The theater, when you're the one operating, if you enter the theater, you cannot use your normal uniform or any clothes you wear outside and enter the theater. You must remove it. There's a changing room. Okay, that's the changing room. Your hand will be like this. Do you understand? You enter the theater. Because it's contaminated. You are going to open somebody up. You know your skin is what protects every germs and disease from entering your body. But now, when we enter the theater, we open you up. Do you understand? So we say you open, you see your intestine and other things. Do you understand? So we cannot allow our clothes now is contaminated. We cannot use that to enter the theater. Do you understand? The theater is what? A sterile place. Do you understand? The theater is what? A sterile place. So when you wash it, you always keep your hand off. The clothes you wear, and you don't wear the same normal clothes you wear in our normal activities. There's a special clothes for theater. You wear it too. That is to tell you that the theater is what? Sterile place. Everything you're doing. The number one thing you are always fighting is infection. And they say a soldier's number one enemy is what? Infection. It's called sepsis, but I know you don't know what sepsis is, but just carry it infection. The soldier's number one enemy is what? Infection. This is the biggest case of the health facilities. It's the baby that comes out with the mental testing. Have you heard of tetanus before?
Yes.
You heard of tetanus before?
Yes.
You did say when you match them.
Yes.
The thing is that the bacteria that causes tetanus is on metal. They can live in metal. And in level, when you deliver the baby, you know that the baby is attached to the mother through a cord. So you're cutting that cord. With that cord, that knife, that's scissors you're using. You're using this called to go responding faucet. It's not just for holding things, you want to grab things. You understand? This is the rod. This is the garlic pot. Garlic pot. And this is what we call kidney dish because it's shaped like a kidney. Kidney dish. They put things in there. You can even put if you do surgery and you want to remove something, then you need to send for lab. As you're doing the surgery, put it here for the first time. Then you put special chemicals inside it, and you take it to the lab. Like cancer, when we remove tumor for cancer, we'll take it for lab, or we'll take it to the histopathology lab. They bring back the result and tell us the type of drug we use and treat the cancer for the time being, or the tumor. So, there are no this is, you don't need to know about this one, and this is for, if you want to examine the vagina, you use this. You put this end, when you expand the tissue, you tighten it, but there's nothing is tightening. And you now see the wall and you see what you want to see. There are so many cases women come with, it's not funny, because women that usually come with, they are usually serious. Things that usually happen to women here, they don't usually notice late. You understand? But this is not the purpose of it. You don't use it to level. You don't go there that way. You don't use it for the level. What we do is we normal when you're pregnant and the pregnancy is desired and you want to carry it to them, you go to the hospital. The doctor will say first for 4 weeks, then for 2 weeks. Then when it's time for the time you're supposed to give birth, you become 1 week, because there are some conditions a woman to carry pregnancy way past her date, and the baby living inside the womb. The more longer the baby lives, the more the child's condition can get worse, because the child is supposed to expose to the environment. Do you understand?
Yes.
So when it is not, there's something we call induction, or we call induction. You pass the date and it's not, you're not yet enter level. We not induce your level. So normally when a woman is in labor, she will feel pains here, and here, mostly here. This is where they should feel the pain. So we feel the pain here. But that, we usually call that place latent, because nothing else started happening. When the real pain starts, she will scream, and because it's very, 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 very painful. It's worse than menstrual pain, times 10 or times 100. Because I've seen women that have had the pain is so much that they say they don't want to do labor again, they want CS. So, cesarean section. So when the woman is feeling, when the woman is in pain, when she comes in labor, we come here and examine her. We first examine her. If she's in latent phase, we tell her to calm down. We will help her, we will give her some drugs sometimes to speed up the labor, so the labor can start on time. When she's doing it, we tell her, usually tell her to spread her leg and hold her leg, spread it wide, so that the baby will come out. So the baby will come out, then the baby will come out. Then you deliver here. When you deliver the baby here, you drop the baby. You cut one, you cut the other one too. There's blood vessel. If you cut that thing, the mother will bleed to death without clamping it. That thing connects the mother and the baby. That thing has been feeding that baby for 9 months inside the mother's womb. So when we clamp it, we cut it, we separate the baby. Then nothing will not deliver it. This is what we used to do at the baby. So then when we give birth, and after that we give birth. That is more than 1 day or 2 days. But if we do use cesarean section, we will stay here for 5 days. Do you understand? Because it's surgery. Do you understand? Surgical patients is not telling them to go home. So it's a major surgery, like cesarean section. Do you understand? Yes. So we stay 5 days. Usually a minimum of 5 days. Do you understand?
this place now, there are so many positions we use in bed or in patients. So the patient that has cardiac problem, that is breathing very fast, they don't sleep on a flat thing. We raise it. You raise the bed up. So we have it here. Excuse me, let me show you. Look at the hand. You give it level you want it. It has levels. So if it will make the person relief from that, someone is coughing, is having chest problem, we don't need to lie down flat. Are you getting this one now? Get it even at home. You can use pillow and still raise it like this. When somebody maybe come out from surgery, you don't need this kind of bed. You need it to be very flat. Do you understand? So this bed can be manipulated anyhow you want it. This serves as a kind of table. This serves as a protection rail. This is a drip stand. So I talked about oxygen. I'm showing you oxygen. This one nebulizing machine is also oxygen. You've seen the catheter that is showing now. Oxygen kind of. So just place it here. This is a mobile.